Thank you so much for the invitation. I'm really honored to be included among this group of experts at this roundtable, particularly because I actually used to work for Kaiser Permanente. I don't know if you knew this, but I used to manage dental operations in the Northwest for several years. And it was at Kaiser where I first had my aha moment about sugar industry influence. I was actually engaging with wanting to learn more about how dentists could help manage diabetic patients in practice by doing some screenings, and attended a conference on periodontal disease and diabetes, where I learned from the keynote speakers that according to the federal government, there was no evidence linking sugar to chronic disease. And that was back in 2007. And so I learned that from our National Diabetes Education Program representative. And that launched me into an investigation of, wait, who is this sugar industry and how might they have influenced policy? So Bill asked me to share a few slides to provide some context on food industry influence related to nutrition science consensus and how that might relate to federal nutrition policy. And I think my slides are, I'm missing one of my slides. So that's okay. So the first slide was going to tell you about who is the Sugar Association. So I primarily have been focused on the Sugar Association. These are the sucrose guys, cane and beet sugar. It's a trade group based in Washington, D.C., 501c6 organization. You can look at their public tax forms to see what their mission is, plainly stated, which is to promote the consumption of sugar. And their primary public policy goal is to prevent the disclosure of added sugars to the public on packaged food products. They don't want us to know how much sugar is added to those products. And so although we've had some amazing successes, as have been pointed out from the policy perspective of the 10% added sugars limit coming from the WHO, the USDA, the FDA's movement to put the labeling of added sugars on packaged products, that's a great win. But the industry has their eye on 2020, on the 2020 dietary guidelines.
It also might be mentioned that we're at risk of losing that 10% standard.
Exactly, and that's exactly my point. And so they already have their eye on things like, for example, a dietary recommendation for the age group between 0 to 24 months. This was a process that the Department of Health and Human Services had launched back in 2013. It was supposed to be released in 2018. Theoretically, it would have incorporated that 10% added sugars limit. But that process has been delayed and now is going to be incorporated into the 2020 dietary guidelines process. As well, the FDA labeling, the food and beverage industry is working together to also delay the compliance deadline for the added sugars labeling and trying to push it to 2021, which would put it after the 2020 dietary guidelines. And then the Sugar Association's new president, Courtney Gain, has publicly stated that it is their goal to reverse that 10% added sugars limit in the 2020 dietary guidelines. And so that's what's on the horizon. And from a public relations perspective, the way that the sugar industry looks at the dietary guidelines can be framed in the concept of issue management. So issue management is a public relations practice where an organization sets out to have their eye on public policy and to work to align public policy with their organizational goals. So as we already know, the Sugar Association's goal is to promote the consumption of sucrose. And if you look at the dietary guidelines process, you can split it into 4 phases. So the phase that we're in now, between 2014 and 2018, new evidence is being generated related to sugar consumption and health. Moving into 2018 will be the time that the Dietary Guidelines Advisory Committee is being formed and the evidence will be reviewed, systematic reviews being completed. 2020 is the target to release the dietary guidelines, and then finally post-2020 would be implementing those dietary guidelines. Well, the phase that we're in right now, from the Sugar Association's perspective, is the time that they can have the most influence on the 2020 dietary guidelines because the public's interest in the 2020 guidelines is quite low. And so they can be working behind the scenes to generate evidence while the public really isn't paying a lot of attention to this. So the final slide, I want to talk about what I'm calling the funding bias iceberg. So how do we learn about the Sugar Association and how they might influence nutrition science? And there have been several important studies that look at the scientific literature and compare the funding source to the results and the outcomes of the studies. And there's been a significant difference between funding source and the outcomes compared to independent sources, where a food industry funded study is more likely to have a favorable conclusion, but that only tells a very superficial story. We don't really know much just by looking at a funding source. We can't really understand what's going on. And you really need to look beneath the surface, and it's through industry documents research, similar to what has gone on with the tobacco industry, that can really help us understand what's going on behind the scenes. So I'm sorry, my slides are not quite right, so it kind of threw me off. One thing I didn't mention, as far as being in the emerging evidence stage, some things that the Sugar Association specifically has been working on has been related to the birth to 24 months dietary guidelines. And they actually sponsored a symposium in 2015 to gather experts to review the evidence related to sucrose and these dietary guidelines. And they published a supplement in Nutrition Today that just came out last week with about 10 different studies that the Sugar Association sent out a press release announcing this supplement, and it is basically there to promote their position that sucrose consumption is not an issue for the 0 to 24-month age group, with the intent to have that evidence in the scientific evidence base related to the 2020 dietary guidelines. So essentially what I want to encourage you to think about is there's much more going on beneath the surface that we don't learn unless we can see the industry documents. There is another study, the International Life Science Institute, which just published a systematic review of sugar guidelines. And International Life Sciences Institute is another trade group representing food and beverage industry. And they concluded that the 10% limit is based on not credible science, and they were discounting these guidelines. And my colleague and I, Dean Schillinger, were asked to write an editorial that went along with this study, which then launched some press investigation. And Candace Choi with the Associated Press was actually able to find emails through a FOIA request related to this ILSI-funded study, and found that the disclosures that were part of the study were not accurate. And so through this email chain, she learned that ILSI actually had influence on the conceptualization of the study. Okay, I'm being cut off. So again, just wanted to emphasize industry documents that this is a public affairs effort. So the Sugar Association has been working for more than 50 years through public relations channels, with research being one of their focus areas, with the intent to seed the scientific evidence for consideration in the dietary guidelines. Thank you.
Stay there.
Okay.
So we have 3 minutes for questions or comments.
Kimber.
Cristin, why are they so focused on the 0 to 24 months when clearly that's not their biggest source of revenue, that everybody's running around overfeeding babies and toddlers sugar?
Well, I think that it's actually related probably to infant formula and the amount of sucrose.
Okay, I was wondering if they were sitting on evidence suggesting if you catch them and get them hooked on sugar that early, they're there forever?
Yeah, I think that's part of it. I think there's a
it might be.
concern of the amount of added sugars in infant formula and what that does to encouraging sugar consumption later in life.
And not just infant formula, but also toddler formula.
Yes, exactly.
Which is this new product invented to promote sugary beverages in toddlers.
Right. Yes.
So these conflicts of interest, I think, are a real problem, and the question is, who's going to be the police force? I mean, who's going to do something about it? We can talk about it among ourselves, but the question is, will anything change? And I don't think anything will change quickly unless somebody gets after the people who are taking the money, and it becomes embarrassing for them to do it. And the universities can't be the police force because they get money from industry. The scientists themselves can't be the police force because the money is too enticing. The professional associations fail to do it because they get money as well. So I think the police force here is the press. And I think if something's going to happen about this, there has to be a concerted effort, probably from some advocacy organization that keeps in constant contact with the press to let the press know who's taking money from industry and then what sort of science they find. Otherwise, we're talking to each other and not much can change.
Yeah, it's quite an undertaking, and I don't have a good solution. I'm not sure the press is the only answer. I think that the public affairs efforts on behalf of certain trade organizations is massive. And, you know, I'm only focusing on one group, the Sugar Association. There are trade groups, I mean, long list of trade groups with interest in influencing nutrition guidelines. It's a bit overwhelming. I don't know what the right answer is, but we definitely need more eyes on the topic.
It's probably I don't think it's daunting as much as you might think. If some foundation, for example, gave somebody some money to track these things, and then there were regular lists that got circulated to the press, and there'll be people, particularly people in the press, who like to write about this kind of thing. If that information gets circulated and those lists go up on the web and they get widely publicized, it then could become too embarrassing for scientists to take the money to do this kind of thing.
Yes. Yeah, I think that's
And
part.
then the response cost just grows too large, and then there might be probably less of this with time.